down my presentation significantly, I will just touch upon this very important implant, the Innfocus, which is now the pressure flow micro shunt. It is not available in India, but still I'm discussing it. Why? Because I think, and a lot of people think this is the perfect replacement for trabeculectomy that can happen. Now, why do I say that is something that we will discuss soon. So this implant is made of SIBS. SIBS is a material of which many of the cardiac implants are made, and it is amazingly biocompatible. Many people believe it's the most biocompatible plastic that humans have ever made, and it is definitely very small. Now, if you look at the 3-year outcomes, these are amazing outcomes. At 3 years, IOP less than 14. It's happened in 82% of patients without medications. I don't think, even when I am a very confident trabeculectomy surgeon, I can say this about my trabs. And all this has happened without any complications related to hypotony, any BREB-related complications. And that is why my firm belief is, even if it doesn't replace trabeculectomy, it is going to be a very, very, very close competitor for trabeculectomy. Now, this is the surgery that we don't do in India. So I just share a video here. This is a video from IC283. You see, this is not a traditional MIGS. So you make a conjunctival opening around 3 mm behind the limbus. You use a 24 gauge track and go into the anterior chamber above the iris, into the area of the trabecular meshwork, and then place this implant in. So though you have to open the conjunctiva, this is a very brief procedure, and this implant lies there in the subconjunctival space, gives you very diffuse blebs. So I must acknowledge IC283 because he's a person who makes very, very nice glaucoma implant related and phaco videos, and it's a favorite of mine after, of course, T-Series and PewDiePie. No, I'm joking, I don't really. So I'll just briefly again mention about Zen implant. It's a similar procedure, and what happens in this procedure is it's a collagen implant made of pocrine collagen, and it is the reverse direction in which the Innfocus implant was placed. It's placed from ab interno approach, and this is what the implant looks like. And a lot of people actually inject subconjunctival mitomycin before injecting the implant. And once you locate the trabecular meshwork, you can just inject the implant from the trabecular meshwork to the subconjunctival space. It is important to take the needle through the tenon. So unlike trabeculectomy, which is a subtenon thing, unlike Innfocus, which again is a subtenon thing, this implant has to be above the tenons and below the conjunctiva, so that you get a bleb in that area. The problem with both these implants is a frequent and repeated need for needling. So because these implants, the ends of these implants are very small, even if a small fibrous plug comes in there, you will need to go do a small needling. So that is the challenge because of which there are still some reservations about the implants, and I think all of us are very eager to see these coming to us and reduce the surgical times. Now, unlike these two implants, there is an implant that is, or a mix option that is available. So it's the Taj Samudra of all the implants, the iStent. Now, iStent has a time-proven record in many countries in the West, and it's a very, very small implant, the length of which is 1 mm. So this is 1 mm long, and the part that remains in the anterior chamber is 1/4 of that, the snorkel that you see, that helps drain the aqueous. Now, this is a table, a long one, but I want you to focus on only two aspects. So if you see a single iStent, it will reduce the intraocular pressure to somewhere the range of 8.6 to 27.3 millimeters. Now, what is visible along with these numbers is the large standard deviation, which basically means that there is a significant amount of variation in which these eye stents will bring down the IOP by. When one doesn't work, you implant another. So 2 eye stents can bring down the pressure by 27 to 36%. Okay. Now, very interesting trial by Katz et al. They tried, they made 2 groups of consecutive POAG patients, put 1 implant in one group, 2 implants in the other group, and 3 implants in the other group. So they have a very homogeneous population. This is the only non-randomized controlled trial which I would recommend to understand. So 1 eye stent, intraocular pressure level 17.4, 2 eye stents 15.8, and 3 eye stents 14.2. So this is the usual range in which trabeculectomy does. So 3 eye stents is equal to trabeculectomy, but each eye stent is going to cost somewhere between 1.3 to 1.5 for the patient. So when the Ambanis come, you can offer 3 eye stents to them. Once again, this is just a joke. These implants do have a place in our practice. Otherwise, we will not be talking about. The safety of each and every mixed procedure that we have spoken about is amazing. So let us look at the procedure. I will skip the gonioscopy adjustment part and just go to the, this is the only situation when you probably pray for a bleed in the angle where you can visualize it. So you go almost parallel to the trabecular meshwork, go at around 10 to 15 degrees, place the implant there, and then withdraw the injector and just push the implant once more, the eye stent into the trabecular meshwork vertically and horizontally to make sure that it stays in place. This is typically performed along with phacoemulsification after the surgery is over. So it gives you a very good access to the trabecular meshwork and reduces the problems that you could have with the bleed affecting the trabeculectomy, the phacoemulsification later. There is a cousin of eye stent, the eye stent inject, which implants 2 of these modern design or a newer design eye stents into the trabecular meshwork. It costs a little more, but probably will also work a little better than the eye stent traditional one. We have already reached a stage when eye stent is being called traditional. Thank you. We will be happy to take any more questions in say 2